Alright students, let's start our first class. Today we are learning the most basic and most important topic, Introduction to Human Anatomy. I know many of you may feel anatomy means too many names, too many terms, how will I remember? Don't worry, we will go slowly, step by step. By the end of this class, anatomy will feel easy. What is anatomy? It means understanding the parts of the body. In simple terms, anatomy is like Google Maps for the body. It tells you what is present, where it is, what shape it has, and what is near it. For example, if I say biceps muscle, anatomy tells us where the biceps is located, what shape it is, where it starts and ends, which nerve is close to it, which artery runs nearby. So, anatomy helps you find things inside the body without opening it. Why it is important for physiotherapy? Let me ask you a small question. If you don't know where the muscle is, how will you strengthen it? If you don't know joint structure, how will you mobilize it? So, for physiotherapist, anatomy is an foundation where physiology is an application. Together, the treatment will get success. Branches of anatomy. Now, don't get scared by the names. I will explain it clearly. Gross anatomy. Things we can see with our eyes without the use of microscope. For example, bones, large muscles, heart, lungs. In this gross anatomy divided into two types, regional anatomy and then systemic anatomy. Regional anatomy means studying area by area, like head region, neck region, upper limb, lower limb. And systemic anatomy means studying by system, all bones, skeletal system, all muscles, muscular system, all nerves, nervous system. In physiotherapy, systemic anatomy is very important. Second one is microscopic anatomy, also known as histology. It means studying the body under a microscope. For example, muscle tissue, nerve tissue, epithelial tissue. Why physiotherapy needs it? To understand muscle healing, tissue injury, nerve regeneration. Third one is developmental anatomy. It means how the body develops from embryo to adult. Example, how the heart forms, how the brain develops. We don't go deep into physiotherapy, but basic knowledge helps. Radiological anatomy. It means understanding the body through scans and images like X-ray, CT, MRI. Very important for physiotherapists because many patients bring X-rays to OP. You must understand fractures, disc issues and arthritis. Fifth one is clinical anatomy. It means applying anatomy in real life. For example, if a patient has wrist drop, which nerve will affected? Radial nerve injury, which causes wrist drop. This is the part that helps you diagnose. Now, let's talk about physiology. If anatomy tells us what is there, physiology tells us how it works. For example, how muscle contracts, how kidney filters, how heart pumps, and how nerves send signals. Next one is levels of body organization. Our body is arranged in a proper order from very small to very big. It goes like chemical level, cell level, tissues, organs, organ system and human body. This shows how beautifully the body is organized. Okay, before you learn any directions in anatomy, you must know this position. The anatomical position is the standard reference. It is like standing straight, face forward, arms by the side, palm facing forward, feet slightly apart. Even if the patient is lying down, we always imagine them in anatomical position while describing the body. Next one is anatomical planes. How we divide the body into sections. Imagine you are cutting the body into slices like cutting a cake. These cuts are called planes. First one is sagittal plane. Divides the body into left and right parts. Special sagittal plane is median mid sagittal plane. Divides into equal left and right half. Example, nodding your head, yes. It is a movement of sagittal plane. Second one is frontal coronal plane. Divides the body into front, anterior and back posterior parts. Example, jumping jacks. Hands moving up and down in frontal plane. Third one is transverse horizontal plane. Divides the body into upper, superior and lower inferior parts. Example, twisting your body left and right. It is a movement of transverse plane. Simple trick to memorize the anatomical planes. Sagittal, side to side cut. Frontal, front and back cut. Transverse, top and bottom cut. Next we are going to learn about directional terms. How we describe a position of one structure compared to another. Directional terms help us to explain where something is located, like giving directions left, right, above and below. First one is superior, cranial. Example, head is superior to the neck. Second one is inferior, caudal. Below, stomach is inferior to the lungs. Third one is anterior, ventral region, front side. Example, chest is anterior to the spine. Fourth one is posterior, dorsal. The spine is posterior to the heart. Fifth one is medial, towards midline. Nose is medial to the eyes. Sixth one is lateral, away from the midline. Ears are lateral to the eyes. Seventh one, proximal, near to the trunk. For limbs, shoulder is proximal to the elbow. Eighth one is distal, away from the trunk. Examples, fingers are distal to the wrist. Memory trick. Proximal, problem is near and distal, distant away. Last one is body cavities, spaces inside the body that protect organs. Think of cavities as rooms inside a big house. Each room has organs inside. First one is dorsal body cavity, cranial cavity which protects brain and spinal cavity which protects spinal cord. Second one is ventral body cavity. In that, thoracic cavity which protects heart and lungs. Second one is abdominopelvic cavity which protects stomach, liver, intestines, kidney, bladder and reproductive organs. Fourth one is abdominal regions and quadrants. These regions help doctors and physios locate pain or organ problems. Four quadrants. The abdomen is divided into four boxes: right upper quadrant, left upper quadrant, right lower quadrant and left lower quadrant. Example, appendix pain usually right lower quadrant. 9 regions of our body: right hypochondriac, epigastric, left hypochondriac, right lumbar, umbilical, left lumbar, right iliac, hypogastric and left iliac. Example, umbilical region is around the belly button. Okay students, quick summary before we end the class. First we see about planes. There are 3 planes: sagittal, frontal and transverse. Second one is directional terms: superior, inferior, anterior, posterior, medial, lateral, proximal, distal and superficial and deep. Third one is body cavities: dorsal and ventral. And the final one is abdominal areas. There are 4 quadrants and 9 regions. These terms are the language of anatomy. Once you master this language, describing any muscle, bone, or movement becomes very easy. Thank you.